So one of the other things that you hear a lot about in the debate, rhetorically at least from the politicians, is that this bill strengthens Medicare because it brings in more money to the Medicare system through an increase in the Medicare tax. But we know that it really is happening on paper. It's not that we're taking in more money for Medicare and then spending it on Medicare.
Right. I think that one of the important things to remember about the bill is that it does raise a lot of new revenue that's dedicated to the Medicare trust fund. But it's not spent on Medicare. So it's actually sort of funneled through the trust fund, credited to the trust fund, which would make the Medicare system look healthier on paper. But the money will actually be spent on the new expansion of Medicaid and the subsidies. So it's I would take and also we're limiting Medicare expenditures. That's one of the what's one of the cost savings is cutting back on provider payments. So I would be very cautious about claims that we're making Medicare, that we're improving Medicare's status. Basically, we're using the Medicare a trust fund as a sort of money laundering device. It's got kind of like a twofer. They get new revenue and be able to credit it to Medicare. So I think that you got to take that with a grain of salt.
And then I think another one of the misconceptions is that even though we talk about Medicare costs being cut, we're not actually cutting the fundamental cost drivers of Medicare. Even if we're successful in healthcare cost inflation, which the excise tax would help with and other things, you're still dealing with a Medicare program that's unsustainable because there are more beneficiaries and we pay for most of that out of general revenue anyway.
Yeah, right. I think that, one of the important things to keep in mind is, whether it's Medicare or the federal budget, is I sort of look at this bill and think we still have so much more to do.
Yeah.
I mean, nobody should, daunting as this has been, it's a sign of things to come. We're going to be dealing with these issues henceforth. And because, we do have the aging of the population, and no matter what we do with healthcare costs, it's going to cost more simply because there are more people. And even the most ambitious plans to control healthcare costs would still have it growing faster than the economy. So, this bill, as I say, I think I look at it as a way of bringing more people, almost everybody, into the system, but we still haven't figured out a way not just to pay for it, but to slow the growth of healthcare costs sufficiently to make it all affordable. So anyway, I think the message here is the cost control efforts have to go forward aggressively, because just to meet the targets of this bill,
right,
and then to do better.